Hello, welcome to Wellbeing. I'm Guy Murphy. Today my guest is Professor Anthony Montgomery, who is a researcher at Northumbria University in Newcastle-upon-Tyne in England, and today we'll be talking about burnout in the workplace. Thank you for joining me on the show today, Anthony. So, Anthony, what first got you working in the field of occupational and organisational psychology?
Well, Guy, thanks very much for inviting me on your show. So after I'd done my BA and my Master's, I wasn't quite sure. I knew I wanted to do a PhD, but I wasn't quite sure, which topic I wanted to go after. So I decided to do some work as a research assistant. And it was one job in particular. So this is in the 1990s. I was working for the Royal College of Surgeons in Ireland. And as part of my job, I had to visit every cardiac unit in every general hospital in Ireland. At that time, there was about 40 of them. So the focus of the project was actually on secondary prevention of what they call myocardial infarct or a heart attack, which involved me collecting data from medical records. However, I was spending, 1 to 2 days in these units, sitting quietly at the centre of the action, and I became very interested in the interpersonal relationships between the staff, the communication, the pressure, the highs and lows of their jobs. And I realized that these places were populated by highly motivated people who carried the weight of their patients, in themselves. And it started to become obvious to me that, some were coping much better than others. And so I started to read about this phenomena of stress and work stress. And I came to realize that burnout was the phenomena that best described some of the scenes that I was observing. So following that job, I contacted a professor in the Netherlands. His name was Wilmer Schoutely, who was an expert in burnout. And I went to the Netherlands and I did a PhD about burnout in the Netherlands. And that's how it all kind of kicked off.
Fantastic. And how would you define well-being and burnout in the context of the workplace?
Yeah, so let's kind of start off with just the kind of more, I suppose, the more lay understanding. So when we think about burnout is a form of chronic stress, yeah? And the important point is that kind of not everybody will experience it in the same way. Some people will feel exhausted by their work. For some people, their job won't be meaningful. And for other people, they feel that they can't make a difference anymore. So that's the way people will feel. From a psychological perspective, we think of burnout as being composed of three things: of exhaustion, so you feel exhausted, which leads you to be, either cynical about your job or feel depersonalized. And that leads to the third element of burnout, which is referred to as kind of reduced professional efficacy, or as I said, you feel like you're not making a difference anymore in your job. So it's characterized by these three elements. And usually we know from research that it's the emotional exhaustion, which leads to the cynicism, which leads to this feeling that you're not doing your job as well as you could, and it becomes a kind of a vicious circle.
I just wanted to quickly talk about, you mentioned a few individual differences when it comes to burnout. What are some factors that kind of influence the, individual experience of this phenomenon?
Yeah, I think what's very important to say is that, burnout is about managing people's relationship with their job. Yeah. So the best way to think about burnout is it's about kind of viewing as a breakdown in people's relationships with work that brings the focus of action on these relationships. So it's the relationships that people have with their work, in a sense. That is the core element of burnout. And that's something that sometimes can be missed. So people sometimes focus on the individual experience of burnout, people feeling very, very chronically stressed. But we mustn't lose sight of the important element, that is the fact that it's very much about, your reaction and how you're coping with the organization you're working in.
Okay, so the main individual difference, in terms of, if we compare two random individuals, the main difference is going to be how they interact with their workplace and their attitudes towards their workplace and that sort of thing. Is that correct?
Yeah, so it's the interpersonal, it's the relationships that they're having in their work that's critical. For some people, different people will have different experiences in different workplaces. But it's this interactional element that's very, very important in talking about burnout, yeah.
Interesting, okay. And what do you see as the biggest misconception that business leaders have about burnout at work?
Yeah, no, there's quite a lot, I suppose. So for some, burnout has been kind of incorrectly treated as a personal weakness. Yeah. So there's this kind of sense in which burnout, a lot of organizations, they've tried to treat burnout as a sort of more like a kind of disease or a disability. And this is kind of what this has done is it sort of avoided the fact that it's about the relationship that individuals have with their workplace. Yeah, That's one big misconception. A good way to think about this is, the burnout researchers, we talk about what's called the canary in the coal mine. Have you heard this example, the canary in the coal mine?
Not in the context of burnout, no.
All right, so it's this idea that canaries, and they go down in coal mines and they're there to detect noxious gases. And when they detect the noxious gases, they die. The coal miners know that they have to leave because very soon they're also going to suffer from these kind of noxious gases. So it's this idea that canaries are very expendable and they're very cheap, et cetera, et cetera. And this obviously was a practice many years ago in the coal mining industry before technology became much more widespread. Okay. So there's a sense in which employees are a bit like those canaries. And, there's a sense in which it's kind of, if somebody gets burned out, we'll just find other canaries to do the job. And so there's this kind of, there's this sense in which not this inability to see the bigger picture of the fact that it's the organization, it's what the organization is doing that is influencing individuals, and that this is, when we find burnout in an organization, that means we need to change things in the organization. We just don't need to get stronger, more resilient people. That would be the wrong way to do it, the wrong interpretation of burnout. And the other big problem in the field, in business generally, and just in the public, is there's a lot of exaggerated claims about the level of burnout experienced by a group of employees. So the way we measure burnout is that we use a kind of a research tool. The most common one is called a Maslach Burnout Inventory. It was developed by Christina Maslach and Michael Leiter. And a lot of the time you'll read in the media or the newspapers, that 80% of people are burned out or 70% of people are burned out. And this is not a valid or sort of reliable way to report. We can't diagnose burnout in that particular way. Okay. And that's another sort of misconception that's out there about burnout. Yeah.
Just coming back as well to the the canary in the coal mine. To me, my interpretation of that is that companies and organizations sometimes view employees as expendable. Hence the. Exactly. So is that kind of one of the more sort of, I suppose, nefarious or pervasive attitudes that can cause people to burn out?
Yeah, so to take what you just said, you put it quite nicely. You said, that sometimes they see them as expendable. I think at an even greater level, there's an element in which well-being and burnout are not really strategic goals of a lot of organizations. Yeah. So the way that they organize the workplace and the way that they organize the way things are done, if well-being and burnout were the strategic goals, they would organize their workplaces in a very different way. So in many ways, it's productivity, which is the strategic goal, and profit, for example. And so well-being can sometimes be seen as a luxury, and that's why people can be seen as expendable. Yeah.
Yeah. And how might organizational culture positively or negatively impact individuals' well-being on a daily basis?
Yeah, so culture is a really important element here. So kind of imagine you start a job, it's your first day, and you walk around the organization, you see all these posters and information about well-being and about how this organization is committed towards taking care of its workers' mental and physical health. But then imagine, it's your first job, you're in your first meeting, and your manager is telling everybody that everybody's going to have to do more unpaid overtime. So that's a nice difference between the kind of strategy and culture, yeah? So the strategy seems to have been that, oh yes, we're going to, people are going to be protected, their physical and mental well-being are going to be protected. But the culture is very much that people need to do unpaid overtime. So I think when we talk about organizational culture, we're really talking about the difference between strategy and culture.
So, what kinds of workplace practices or organisational norms do you think influence burnout?
Yeah, maybe a good way for your listeners to think about this is it's the old analogy of the kind of the boiling water with the frog. That the frogs, kind of the water starting to boil, but the frogs are not jumping out in a sense. And it kind of, it doesn't jump out because the water boils very slowly. And a good way to think about the kind of work practice and organizational norms is that they're sort of sublethal and they're under the radar, but they're chronic and they're happening every day. And so because they're sublethal and they're not, they're not very dramatic, it's the kind of the work pressure, it's the workload that it's influencing you and it's exhausting you and it's making you more cynical. But it's not happening in a very, a very strong, dramatic way that it's basically, it's wearing you down. So it's the work practices that wear you down over prolonged periods. And, also you have the other problem that sometimes for employees, burnout can be kind of a badge of honor. So you have these two things working in a very kind of dysfunctional way. So on the one hand, it's the small things in your work, to having to stay that little bit later, to having to do that extra bit of work, to having a boss maybe who's not communicating with you in a nice way. These are kind of, feeding into your burnout. And on the other hand, there's there can be a culture in a lot of workplaces where burnout is a kind of a sign that you're working hard and you're performing well. And the two things coalesce together. And this really makes burnout much more likely and much more problematic.
So what's the role of psychological safety, i.e. employees being comfortable to express how they feel in burnout?
Yeah, so psychological safety is a very, very important and interesting component of burnout. So as you kind of said yourself, psychological safety is about people's feeling that they can express themselves comfortably with those around them. Yeah, and they can kind of share information. So you'd imagine that psychological safety is very desirable because it's been linked in research to reduce feelings of burnout. It's also been reduced to people being more likely to learn things and development. And also it's been linked to people, just people's general well-being because they can go to work every day and they can share things with their colleagues. However, it's the psychological safety, it's a bit complicated. And it's complicated by the fact that even though we study psychological safety a lot, we're still not sure how to create it. That's one of the big challenges for people like myself in my field, that we study organizations and we try to assess psychological safety. But if you actually asked us to create psychological safety, we don't quite know how to do it yet. It's quite difficult.
Oh, okay.
And one of the reasons why it's probably quite difficult is because psychological safety is about, being able to say and share certain information. Now, what you find among people is that people in their work, in their occupations, sometimes they learn that certain things can be shared and certain things can't be shared.
Yeah.
Yeah. So it looks as though they're sharing information. It looks as though they're, talking with their colleagues. It looks as though they're speaking up, it's called. But we can't discount the fact that they may be they may be not sharing things which they know they shouldn't share in this particular situation. So in that sense, psychological safety becomes a little bit complex.
Absolutely. And just coming back to, workplace culture again, surely that's sort of classified as an inherent part of culture, isn't it, as well? I mean, how open people are with their feelings and that sort of thing.
Yeah, I mean, my colleagues and I we published an interesting paper about psychological safety and patient safety. So you would imagine in healthcare that psychological safety would be associated with better patient safety, meaning that, that if healthcare professionals feel confident that they can talk up and speak and share information, that this important information that they're sharing with their colleagues should lead to less patient safety, should lead to better patient safety. But what we actually found in our research that we published was that there wasn't a lot of evidence to suggest that the two were very linked, and it's because of what I told you before, that it has a complex relationship, psychological safety and something like patient safety. So while you might expect them to be very strongly linked, when you look at the research that's been done, you find that sometimes in some situations where teams have reported more psychological safety, there actually seem to be worse patient safety. And that may be because, we don't know, but that may be because the psychological safety, it's the first time that they're actually speaking up about different problems in their in their workplace. Yeah.
Right, very interesting. And looking ahead, what workplace or societal changes do you think are most likely to shape how organisations think about employee burnout and well-being?
Yeah, I think the elephant in the room here is definitely artificial intelligence. Yeah, I think it's definitely on everybody's horizon. So the thing about artificial intelligence is that historically, employee well-being has kind of played second fiddle to technological innovation. So, for example, even in the interwar years, initial attempts to improve working conditions were driven by a need for greater productivity. So even, historically, even when there were technical innovations, it was never quite linked to better well-being. It was always linked to greater productivity. And this problem has kind of stuck with us in terms of artificial intelligence. So, for example, businesses around the globe, they're using things like emotional recognition technology to monitor employees for engagement, productivity, compliance, and increasing well-being. And it's not clear yet whether we have the appropriate theoretical and methodological tools to comprehend the divergent goals of economic growth and employee self-determination in this increasingly digital workplace. Neurotechnology and emotional AI are creating a new kind of line manager. So it's this interesting sort of, tension between using AI to be more efficient, inverted commas, but also the challenges that has for employees being self-determined individuals, because being self-determined as an individual is very important to your well-being. But if AI systems degrade that, then we have a problem. We have a problem of AI being, on the one hand, seen to be more useful for productivity and efficiency, but also challenging well-being in a very detrimental way.
Absolutely. And, you mentioned that artificial intelligence has become a new sort of line manager. Would you mind sort of expounding on that a little bit more?
Yeah, it's what I was saying. So a lot of companies now are using emotional recognition technology to monitor employees for things like engagement, productivity, and compliance, and increasingly well-being. Yeah, so they're actually using this technology to monitor people in organizations to make sure that they're being productive, that
Right.
they're smiling, that when they're talking to customers, that they're doing all the right things to improve customer safety. Customer satisfaction. Yeah.
Right, okay. So the managerial aspect is sort of monitoring employees and watching their emotions and state of burnout and that sort of thing. It's a bit of a
and
scary...
making sure that they're showing the appropriate emotions or they're doing the appropriate behaviors.
Yeah, quite strange.
Yeah, no, it's a very interesting. It's evolving. The problem, of course, is that the technology is moving so fast that academics are all just catching up with it. All the academics from psychology, law, engineering. I mean, the ethical challenges are very big, but we're kind of running behind it to some degree.
Absolutely. And what do you think organisations should do differently if they genuinely care about burnout?
Yeah, well, the first thing they have to do is they have to authentically invest in the well-being of their employees. Yeah. So we know burnout has a big downstream impact on our physical and mental health. But I think in reference to your question, in order to really address burnout, we can't leave it just to organizations. Yeah. It has to be a collective effort. Organizations are part of it, but we also have to, it has to be NGOs, it has to be government regulation, it has to be public debate in order to kind of nudge organizations to make well-being the strategic goal. I think we can't just rely on organizations alone, because I think if we do that, then it's going to be very unlikely. So in order to really get organizations interested in well-being in a strategic way, we have to address it from as many different aspects as possible. And if you think of something like, I mean, just to give you a sort of a nice analogy here, if you think of, it wasn't that long ago that we introduced seatbelts in cars, right?
Mm.
And as you probably know, there was a lot of resistance initially when seatbelts were being introduced in cars, but eventually it was decided that, to prevent lethal accidents happening, seatbelts would have to be, first of all, mandatory, and would actually also have to be an offence not to have people get fined if they don't have seatbelts. And you saw a similar pattern with things like smoking, where the biggest impacts we made with people's smoking behaviour was to ban it in as many places as possible, and to make it incredibly, to make it very kind of something that people didn't want to do, to make it very unpopular. And I think if we're going to solve burnout, we can't just rely on organisations themselves. It has to be collectively from different angles.
Okay. And what sort of, in terms of the approach and the angles that you've mentioned, what specifically would they be?
Yeah, well, why don't I give an example? So at the moment, I'm part of a team, and we receive funding from the British government to look at workforce retention issues in underserved areas in health and social care. Yeah, so this is a group, health and social care workers in the UK. They're a group who suffer from a lot of burnout, and they have big problems with retention and recruitment. And this is particularly true in what we call underserved areas. So these are areas which are in parts of the country which are more socioeconomically disadvantaged. Now, in our project, in order to change the narrative about that, we've involved professional organisations, we've involved patient groups, we've involved charities, we've involved NGOs, we've involved government policymakers. So when you want to change something, when you want to change the way that people feel about well-being in a particular industry, like we're doing with healthcare, you need to have as many stakeholders as possible in order to push this new narrative and to push this new agenda.
Well, we're starting to run out of time, but I just wanted to finish off, Professor Montgomery, by asking you, what's on the horizon for you in terms of your research into burnout?
Yeah, so at the moment I'm working on developing an open systems approach to burnout. And so I'm interested in the idea that it's factors outside of the organization which also influence burnout. So most of the research and the literature to this point has focused on what's happening inside the organization and how that influences burnout. And this is correct, and obviously we should keep looking at that. But I'm also asking the question, well, what are the kind of economic factors which are influencing people's burnout? What are the sort of cultural? What are the technological? What are the ecological? So I'm interested in what are those factors which are around us every day. Things like that it's difficult to pay your rent, that there's inflation, that sometimes some people have to get second jobs sometimes to kind of make ends meet. So what are these kind of environmental external factors which are also influencing people's burnout levels? We haven't studied these as much as we should have. But I think for me, I've started to realize after about 20 years of studying burnout that it's these factors that are also in our societies and the kind of the social milieu of where we live that have a very, very important impact on how we experience burnout in our work. And it's a recognition that organizations, they're not independent, they're not separate from societies in which they exist, that the societies in which they exist have a big influence on them.
Absolutely. I mean, it seems like a very multifaceted and complex issue. I'm sure that there's, a lot from a a scientific standpoint that we don't yet understand about burnout. Well, it's been very interesting to chat with you today, Professor Montgomery. Thank you for coming on the show. Thank
you very much. It was a pleasure talking to you, Guy.
My guest today was Professor Anthony Montgomery. Thank you for joining us on the show, and thank you for listening. I'm Guy Murphy, and all of us at Wellbeing wish you well.